Hello, in this video I'm going to discuss the case against a causal relationship between psychological stress and infertility. It is well known that infertility and infertility treatment are associated with distress. Infertility-related distress often begins before patients present to a fertility clinic, worsens throughout fertility treatment, particularly after failed treatment cycles, and may become so severe as to equal the distress levels seen in cancer patients. This distress may last throughout the course of a pregnancy and even follow the birth of a healthy child. This distress may also lead to a large number of patients prematurely terminating fertility treatments. The emotional distress associated with infertility is often associated with patients' engagement in self-blame. Many patients believe that it's easy to get pregnant and that because it has not been easy for them, they have done something wrong, and as a result have failed their partner, their family, or that their body has failed them. This self-blame is often associated with a sense of loss of control over one's body and fertility. Patients may seek to regain control over their fertility by making changes to their diets, reducing stress, making changes to exercise, and the like. This feeling of lack of control may in turn lead to anxiety that the patient may be unable to fulfill their family-building dreams. And this anxiety in turn may lead to feelings of grief and loss. But do patients need to blame themselves for their fertility? Does stress impair their ability to conceive? This is a hotly debated question that on the surface appears to be biologically plausible. The physiological response to stress involves the activation of the sympathetic nervous system and the inhibition of the parasympathetic nervous system to defend against harm. This in turn may inhibit the HPG axis, thus negatively affecting fertility. However, research confirms that neither the sympathetic nor parasympathetic systems are completely shut down during times of stress, and that both systems constantly provide input to the body. Research has also been conducted which assesses the role of stress as a cause of infertility. One of the most common areas of research includes survey-based assessments of patients' levels of distress and subsequent fertility. However, this research, as well as relevant randomized controlled trials, are associated with contradictory findings and significant methodological concerns. Researchers have also explored the role of elevated stress hormones, such as alpha amylase and cortisol, on pregnancy. Little to no support exists currently for a role for cortisol in pregnancy. However, research on alpha amylase is marked by methodological concerns, but has found a longer time to conception with no overall difference in chances of conception. Finally, there are inconsistent findings and again methodological concerns associated with research examining whether or not relaxing conditions such as psychotherapy, acupuncture, adoption, or stopping or starting fertility treatments improve pregnancy rates. Overall results of research suggest little to no relationship between stress and infertility unless someone is too stressed to have sex or has developed stress-induced hypothalamic amenorrhea. Research on depression and anxiety, as well as relaxing, are not reliably associated with changes in pregnancy rates. Further, conception while waiting for or following fertility treatment and those who adopt are equivalent to the normal chances of pregnancy based on their infertility diagnosis and/or patients who were inappropriately referred for treatment. Finally, at best, there may be a delay in the time it takes to get pregnant, but if such a delay is attributable to stress, it is not clinically meaningful as it does not reduce overall chances of pregnancy. In conclusion, distress is a well-accepted consequence of infertility, and as a result, the provision of continued emotional support for patients appears warranted. However, given the limited support for, at best, a small causal relationship between stress and infertility, as well as anecdotal data that many patients feel blamed for their infertility, it seems inappropriate to tell patients to just relax as a way to improve pregnancy chances. Thanks for watching.